The liver is one of the most vital and resilient organs in our body. It performs essential functions that keep our bodies in balance. However, often the signs that something is wrong can be subtle and are easily overlooked. Have you ever felt unexplained fatigue, had persistent digestive problems, or noticed changes in the color of your skin? These can be more than just annoyances, they can be signs that your liver is crying out for help. Recognizing these symptoms early can be crucial to avoiding more serious complications. In today's video, we'll explore the main signs your body may be giving you, indicating that your liver is suffering. We'll also share valuable tips on foods you should avoid to protect your liver's health and amazing superfoods like moringa powder, which is an incredible source of antioxidants that will help turn your liver into a veritable fortress against toxins. Get ready to discover how small adjustments to your diet can make a big difference to your well-being. Stay with us until the end and discover the gift we've prepared so that you can take better care of your liver and lead a healthier life. The liver is a multifunctional organ that acts as a real processing center in our body. It is responsible for functions such as detoxifying the blood, producing proteins that are essential for coagulation, and storing vitamins and minerals. In addition, the liver helps metabolize carbohydrates, fats, and proteins, thereby regulating blood glucose levels and contributing to energy balance. A healthy liver is essential for our general health. Without it working properly, our bodies would not be able to eliminate toxins, digest food properly, or fight infections. That's why it's essential to pay attention to the signals it sends us when something isn't right. Let's get to know the main signs that the liver is suffering. 1. Excessive fatigue. Have you been feeling tired even after a good night's sleep? Excessive fatigue is one of the first and most common signs that the liver may be suffering. When the liver isn't working properly, it can't process the body's toxins efficiently, which can result in a buildup of toxic substances in the bloodstream. This buildup directly affects the central nervous system, resulting in a persistent feeling of tiredness and weakness. This can occur because of inefficient liver detoxification. The liver is responsible for detoxifying the blood, removing harmful substances from medicines, alcohol, and cell metabolism. When the liver is damaged, its detoxification capacity decreases, leading to a buildup of toxins that cause tiredness. Another reason is the occurrence of alterations in energy metabolism. The liver plays a crucial role in energy metabolism, storing and releasing glucose as needed. Liver problems can result in inadequate glucose production and release, which contributes to fatigue. One factor that cannot be ruled out is chronic inflammation. Chronic liver diseases, such as hepatitis and cirrhosis, often cause inflammation. This inflammation can provoke a response from the immune system, which, in turn, contributes to feelings of tiredness and exhaustion. In addition to excessive fatigue, people with liver problems can experience a number of other symptoms, including muscle weakness. The feeling of weakness can be intense, making everyday activities difficult. Daytime sleepiness. Even after a full night's sleep, sleepiness during the day can be persistent. Difficulty concentrating. Liver problems can affect the ability to concentrate and perform simple mental tasks. To diagnose the cause of excessive fatigue, it is important to consider a complete medical history and carry out physical examinations. It is important to always seek the advice of a health professional, who will order blood tests to assess your body's liver function. Some strategies should be adopted in conjunction with the specialized treatment indicated by your doctor. Eat a healthy diet. Consuming a diet rich in fruits, vegetables, lean proteins, and whole grains can help provide the necessary energy and support liver function. Avoiding processed foods, trans fats, and refined sugars is crucial. Although it can be difficult due to fatigue, light to moderate exercise can improve energy and overall health. Activities such as walking, yoga, and stretching are beneficial. Stay hydrated. Drinking healthy fluids regularly is essential for the proper functioning of all the body's systems, including the liver. Drinking water throughout the day helps eliminate toxins. Practice stress management. Stress management techniques, such as meditation, deep breathing, and relaxing activities, can help reduce the burden on the body and improve the general feeling of well-being. Don't drink alcohol. Alcohol and drugs can aggravate liver problems and increase fatigue. Avoiding them is a fundamental part of improving liver health. If you are experiencing excessive fatigue and other symptoms associated with liver problems, it is crucial to seek medical advice. Early diagnosis can prevent more serious complications and help implement an effective treatment plan. Our viewers asked for it and we got it. Moringa oleifera pure. A very special discount. Money back guarantee. Click on the link in the first comment to find out more. 2. Yellowing skin and eyes, jaundice. Jaundice is a classic symptom of liver problems. It occurs when bilirubin builds up in the blood, resulting in a yellowing of the skin and eyes. If you notice this change, it's important to see a doctor immediately. Jaundice is a medical condition in which the skin, eyes, and other tissues of the body acquire a yellowish color. This phenomenon is caused by the accumulation of bilirubin, a yellow pigment produced by the breakdown of red blood cells in the blood. Normally, bilirubin is processed by the liver and excreted through bile. However, when the liver is unable to process bilirubin effectively, it accumulates in the blood and tissues, resulting in jaundice. There are various conditions that can lead to the development of jaundice, many of which are directly related to liver function, such as inflammation of the liver caused by viral infections, or excessive consumption of alcohol or toxins. Another associated cause is obstruction of the bile ducts. This is caused by the formation of gallstones, tumors, or inflammation that can block the bile ducts, preventing the excretion of bilirubin and resulting in jaundice. In addition to the yellowing of the skin and eyes, jaundice can be associated with other symptoms. It is important to look out for other signs of liver damage such as dark urine, light stool, intense itching, nausea, and vomiting. The treatment of jaundice depends on the main cause. It is best to consult a doctor and completely abstain from alcohol. It's also a good tip to maintain a balanced diet and avoid processed foods that can overload the liver. 3. Abdominal bloating. A compromised liver can lead to the accumulation of fluids in the abdominal cavity, a condition known as ascites. This swelling can cause discomfort and be a sign that the liver is struggling to perform its functions. Abdominal swelling, also known as ascites when referring to the accumulation of fluid in the abdomen, is a common symptom of liver problems. This swelling can be uncomfortable and, in severe cases, painful, affecting the quality of life of those suffering from the condition. The liver plays a vital role in regulating body fluids. When it is compromised, various conditions can lead to the accumulation of fluid in the abdominal cavity. One of the causes can be cirrhosis of the liver. Cirrhosis is the formation of scar tissue in the liver as a result of chronic damage. This scarring prevents the normal flow of blood through the liver, causing increased pressure in the portal vein, portal hypertension. This pressure leads to fluid leaking from the blood vessels into the abdominal cavity. Portal hypertension can also be one of the reasons for abdominal swelling. The increased pressure in the liver's blood vessels causes fluid to accumulate in the abdomen. Liver failure can also cause bloating. It occurs when the liver cannot produce enough albumin, a protein that helps keep fluid inside the blood vessels. People with hepatitis can also experience abdominal swelling. Hepatitis is inflammation of the liver caused by viruses or toxins can compromise liver function, resulting in a buildup of fluid. As well as a visible increase in the size of the abdomen, abdominal swelling can be accompanied by other symptoms such as abdominal discomfort or pain, difficulty breathing, loss of appetite, and swelling in the legs and ankles. Treatment for abdominal bloating depends on the underlying cause and the severity of the condition. It is important to reduce salt intake in the daily diet to help reduce fluid retention and to avoid alcohol consumption. Also, maintaining a healthy weight will go a long way towards recovery, so it's important to eat a balanced diet and exercise regularly. To diagnose the cause of abdominal swelling, a doctor should always be consulted to treat the problem early and avoid further complications. 4. Loss of appetite. Why is loss of appetite a symptom of liver problem? Loss of appetite can be an early sign that the liver is not functioning properly. When the liver is compromised, it cannot carry out its functions efficiently, including digestion and the metabolism of nutrients. This can result in an early feeling of satiety or a lack of interest in food, leading to unintentional weight loss and malnutrition. There are several liver conditions that can lead to loss of appetite, such as hepatic steatosis, known as fatty liver, which is the excessive accumulation of fat in the liver, causing inflammation and damage to liver cells, leading to a loss of appetite. Consulting a specialized professional can help to discover the cause of the lack of appetite and start an effective treatment as soon as possible. The doctor can also recommend nutritional supplements and dietary changes, which can help ensure that the patient receives the necessary nutrients, even with a reduced appetite. Along with medical treatment, there are some great tips for improving appetite. Eat small, frequent meals. Eating small portions of nutritious food several times a day can be easier than trying to consume large meals. Choose foods that appeal to your palate. Preparing dishes that are visually appealing and have pleasant aromas can stimulate the appetite. Make nutritional drinks that can help ensure adequate calorie and nutrient intake. Avoid consuming fatty and heavy foods. Foods that are difficult to digest can further reduce appetite. Opt for light, easily digestible foods instead. Always stay properly hydrated. Staying well hydrated is essential for the general functioning of the body and can help improve appetite. Loss of appetite can be an important sign of liver problems and should not be ignored. Recognizing the symptoms and seeking diagnosis from a qualified professional can help prevent serious complications and ensure the patient's overall health. Maintaining a balanced diet, managing associated symptoms, and following medical advice are key steps to improving appetite and quality of life. If you are experiencing persistent loss of appetite, consult a doctor for a full assessment and appropriate treatment. 5. Clear stools. Our liver is a veritable powerhouse of life. It filters toxins, stores nutrients, and aids digestion. Without it, our health would quickly disintegrate. However, like a power plant, it can wear out, and when it does, the signs are subtle but present. Did you know that pale stools can be one of these signs? Normal stools have a brown color due to bile, a fluid produced by the liver. When something is wrong, this color can change. Clear stools can indicate that the bile is not reaching the intestines as it should. This can be an indication of diseases such as hepatitis, cirrhosis, or even biliary obstruction. Have you ever felt tired for no apparent reason? Have you ever had a strange feeling of abdominal discomfort? These little signs, along with a change in the color of your stools, could be a silent cry from your liver for help. We live in a world where we are constantly bombarded with information, but, paradoxically, we often ignore the most important information, that which comes from within us. It's important to see a doctor. A simple blood test can reveal a lot about the health of your liver. In the meantime, take care of yourself. Avoid drinking alcohol, eat a balanced diet, and have regular checkups. 6. Easy bleeds. Why is easy bleeding a sign of liver problems? The liver plays a crucial role in blood clotting. It produces various proteins necessary for clotting, known as clotting factors. When the liver is compromised, the production of these proteins can be reduced, resulting in easy bleeding and difficulties in stopping hemorrhages. This is a worrying symptom that can indicate serious liver problems and requires immediate medical attention. In addition to easy bleeding, people with liver problems may experience other symptoms related to poor clotting, such as large and frequent bruises, even from minor impacts or bruising for no apparent reason. Another symptom is frequent nosebleeds, which are difficult to control. Bleeding gums during toothbrushing or spontaneously are also signs that should not be overlooked. A sign of liver problems is gastrointestinal bleeding. The presence of blood in the stool or vomiting with blood can indicate internal bleeding. Easy bleeding is a clear sign that the liver may not be working properly. Recognizing the symptoms and seeking diagnosis and treatment from a specialized doctor are essential to prevent serious complications. If you notice frequent or unexplained bleeding, see a doctor immediately for a full assessment and appropriate treatment. 7. Mental confusion. Hepatic encephalopathy is a condition that occurs when the liver is unable to remove toxins from the blood, resulting in mental confusion, disorientation, and even memory loss. This is a serious sign that needs immediate medical attention. Mental confusion, also known as hepatic encephalopathy when associated with liver problems, is a condition characterized by a change in mental state and cognitive ability. It can range from mild concentration difficulties and mood swings to severe states of disorientation, coma, and even death. It is a sign that the liver is very compromised and can no longer adequately filter toxins from the blood, resulting in the accumulation of these toxins in the brain. Prolonged inflammation of the liver can lead to enough damage to interfere with liver function and cause neurological symptoms. What is known as a portosystemic shunt can also occur, which is the abnormal detour of blood from the liver into the systemic circulation, which can be associated with cirrhosis, allowing toxins to bypass the liver and enter the bloodstream directly. The symptoms of hepatic encephalopathy can vary in severity and can be associated with mood swings, concentration difficulties, disorientation in relation to time, place, and identity, excessive drowsiness, and incoherent behavior, such as nonsensical attitudes and speech. Hepatic encephalopathy is treated by reducing the levels of toxins in the blood to improve liver function. It is also advisable to reduce animal protein in the diet to reduce ammonia production and avoid alcohol consumption. If you or someone you know is experiencing symptoms of mental confusion, it is vital to seek immediate medical attention for a full assessment and appropriate treatment. Foods to avoid to protect the liver. Alcohol. Alcohol is one of the liver's biggest enemies. Its excessive consumption can lead to conditions such as alcoholic hepatitis, cirrhosis, and even liver cancer. Reducing or eliminating alcohol consumption is key to keeping your liver healthy. Refined sugars. Refined sugars, found in sweets, soft drinks, and many processed foods, can cause an increase in fat in the liver, leading to a condition known as hepatic steatosis. Opting for natural sugars and moderating the consumption of sweets is a good practice. Trans fats. Trans fats, found in fried and processed foods, are extremely harmful to the liver. They increase levels of bad cholesterol and contribute to the accumulation of fat in the liver. Processed foods. Processed foods are rich in preservatives, additives, and sodium, which can overload the liver. Preferring fresh and natural foods is a healthier choice. Excess salt. Excessive salt consumption can lead to fluid retention and increased blood pressure, conditions that can overload the liver. Moderating salt intake is crucial to maintaining liver health. Foods that benefit liver health. Morina powder. Our liver is an organ that often goes unnoticed, but it works tirelessly, mainly filtering out toxins and keeping our body in harmony. It is a silent guardian, a fortress that protects our health. And like every guardian, it also needs care and support. Morina, known as the tree of life, is an incredible source of antioxidants, vitamins, and minerals, all ready to help the liver in its daily work. Morina powder is rich in antioxidants such as vitamin C and chlorogenic acid. These compounds help neutralize free radicals, reducing oxidative stress in the liver. It's like giving our guardian a shiny suit of armor, strengthening its defenses. Studies show that Morina can help regenerate liver cells. Imagine a forest being reborn after a devastating fire. That's the kind of renewal Morina can give our liver. Morina also has anti-inflammatory properties, helping to reduce inflammation in the liver. As a soother for a tired soul, it brings balance and peace, allowing the liver to function more effectively. To incorporate Morina into your life from now on, try sprinkling a teaspoon into your morning smoothies, soups, or even a glass of water. Every little gesture is a step towards a healthier liver and a revitalized body. Vegetables such as broccoli, cauliflower, and cabbage are rich in fiber and antioxidants that help detoxify the liver and improve its function. Another great ally for the liver is garlic. It contains sulfur compounds that activate liver enzymes, helping to eliminate toxins from the body. Including garlic in your diet can promote liver health. Fruits such as oranges, lemons, Lemons and grapefruit are rich in vitamin C and antioxidants that help improve liver function and prevent liver damage. Walnuts, being an excellent source of omega-3 fatty acids and antioxidants, also help to reduce inflammation and protect the liver. The liver has a remarkable capacity for regeneration. However, continuous and chronic damage can compromise this ability over time. Being attentive to the signals your body sends out can be crucial in identifying liver problems and taking action in time to prevent serious complications. Maintaining a balanced diet, avoiding harmful foods and including those that benefit the liver, is a fundamental step in promoting liver health. Remember, if you notice any of the symptoms mentioned, seeking medical advice is always the best choice. Our viewers asked for it and we got it. Morina Oleifera Pure. A very special discount. Money back guarantee. Click on the link in the first comment to find out more.
Don't forget to hit the subscribe button and tap the bell icon to keep up to date with our latest videos. If you find our content useful, please give us a like and share our videos with your friends and family. Let's spread the word about natural healing and build a healthier world together. Explore our channel, watch more videos, and embark on your journey to wellness with HealthToday. Thank you very much for joining us.